Some days it's bloating. Some days you're running to the bathroom or struggling to go at all. And the hardest part is this: every test looks normal. So you start wondering, is this really happening or is it all in my head? Today, we're going to gently unpack irritable bowel syndrome, IBS. What causes it, why it feels so unpredictable, and how it affects the body in ways that don't always show up on scans or blood tests. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Now let's start with the most important question. What exactly is IBS? IBS stands for Irritable Bowel Syndrome. It's a functional gut disorder, which means the bowel looks normal, but it doesn't work normally. There's no visible damage, no ulcers, no inflammation, yet the symptoms can be very real and very distressing. So what causes IBS? The honest answer is, we don't know one single cause. IBS happens because several systems in the body stop communicating smoothly with each other. There's no visible damage, no ulcers, no inflammation, yet the symptoms can be very real and very distressing. Think of your gut like a long muscular tube with its own nervous system. Food is pushed forward by gentle, rhythmic squeezes of the bowel muscles. In IBS, these squeezes can become too strong, too fast, or poorly coordinated. When that happens, pain appears. If the bowel moves too fast, diarrhea develops. If it moves too slowly, constipation sets in. But why does this overactivity happen in the first place? One major factor is the gut's nerves. In people with IBS, the nerves in the bowel are often oversensitive. Normal digestion, something most people wouldn't even notice, can feel painful. This is called visceral hypersensitivity. The gut stretches a little, but the brain receives that signal as pain. So IBS pain is real pain, just amplified by a sensitive nerve system. Now here's something many patients notice themselves: stress. About half of people with IBS can trace the start of their symptoms to a stressful time in their lives. A breakup, a job loss, exams, grief, long-term anxiety. Stress doesn't cause IBS, but it can switch it on and make it worse. That's because the gut and brain are deeply connected. This connection is called the gut-brain axis. When the brain is under emotional stress, it sends stronger signals to the gut. The gut responds with spasms, discomfort, urgency, and bloating. That's also why IBS symptoms often flare during anxiety or low mood, even when diet hasn't changed. Another possible trigger is infection. Some people develop IBS after a stomach bug, a bout of food poisoning, or gastroenteritis with vomiting and diarrhea. The infection clears, but the gut never fully resets. We call this post-infectious IBS. The infection may change how the gut nerves react, leaving the bowel sensitive long after the germs are gone. Food intolerance can also play a role, but usually in a smaller number of people. IBS is not a food allergy. It's not celiac disease, but certain foods can trigger symptoms by increasing gas, gut movement, or bloating, especially in a sensitive bowel. In recent years, there's been growing interest in the gut microbiome. That's the community of bacteria and viruses living inside your intestines. People with IBS often have a different balance of gut bacteria compared to those without IBS. This imbalance may affect digestion, gas production, immunity, and even mood, again linking back to the gut-brain axis. Now let's talk about symptoms, because IBS doesn't look the same in everyone. The most common symptom is abdominal pain or discomfort. It can appear anywhere in the tummy. It often comes and goes, and many people notice it eases after passing stool or wind. The pain is often described as cramping or colicky. Bloating is another big feature. Your abdomen may feel swollen, tight, or uncomfortable, sometimes visibly larger by the end of the day. Bowel habits often change. Some people have diarrhea, some have constipation, some swing between both. Stools may be loose, watery, hard, or pellet-like. You might notice mucus in the stool. There may be a feeling of not fully emptying your bowels, or a sudden urgency, needing to rush to the toilet, especially in the morning. IBS can also cause symptoms beyond the gut: nausea, headaches, belching, poor appetite, tiredness, heartburn, even bladder symptoms, sometimes called an irritable bladder. This doesn't mean IBS is spreading. It means the nervous system sensitivity affects multiple organs. Symptoms can be mild and occasional, or long-lasting and disruptive. Most people fall somewhere in between, with flare-ups during stressful periods. Now, a very important reminder: IBS does not cause bleeding. If you ever notice blood in your stool, unexplained weight loss, persistent vomiting, or difficulty swallowing, you must see a doctor. Those are not IBS symptoms. IBS is extremely common. Around 1 in 5 people in the UK experience it at some point. It often begins in young adulthood and is more common in women and those with a family history. So, how is IBS diagnosed? There is no single test that confirms IBS. Doctors diagnose it based on typical symptoms and by ruling out other conditions. Simple blood tests and stool tests are often done to check for inflammation, anemia, celiac disease, bowel disease, or cancer. In most people, scans or colonoscopies are not needed unless symptoms are unusual or start later in life. The key thing to understand is this: IBS does not damage your bowel. It does not cause cancer, but it can significantly affect quality of life. And that matters. The good news is, IBS is manageable. With the right understanding, lifestyle changes, stress management, and targeted treatments, symptoms often improve dramatically. If your gut feels unpredictable, sensitive, or out of control, you are not weak, and you are not imagining it. Your body is communicating in a louder voice, and it deserves to be heard with compassion. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.